Cardiovascular disease remains the #1 killer of women in this country, which I think is not well understood. It actually outranks breast cancer as a loss of life. And after menopause, the risk for women is equal to the risk of men of having a major cardiovascular event. The risk factors for women remain similar to those of men: hypertension, high cholesterol, diabetes, certainly a family history of premature cardiovascular disease, meaning first-degree relatives, parents, siblings who have a cardiovascular event in their 40s, 50s, early 60s. Those folks are at increased risk. Smoking increases the risk in women just like it does in men, and stress plays a major role in women as well. Routine follow-up with a primary care physician after the age of 40 is critically important for routine blood work as well as routine blood pressure assessment. If you do have known cardiac risk factors of high blood pressure or high cholesterol or diabetes, then keeping all of those in check and making sure that your numbers and levels are where they're supposed to be for each of those diseases is critically important. Routine exercise, at minimum 30 minutes on most days of the week of good, moderate-paced aerobic exercise, brisk walking, is also critically important to reduce your risk down the road. Women's presentation with a heart attack is different, or certainly can be different than that for men. They still are likely to have that typical crushing chest pressure or tightness, but they may also experience severe indigestion or pain across the back and shoulders. It can be profound fatigue out of proportion to what they would expect for what they're doing, and it's easy to ignore those symptoms because they aren't what is typically billed as how you present with a heart attack, but we always encourage women not to ignore any symptoms that they think are different than what is usual or typical for them. And also, women as caregivers tend to put themselves last and tend to ignore things, but we strongly encourage seeking medical attention immediately if you develop any of the symptoms I've described. Memorial is an outstanding cardiovascular care center. There's a group of very talented cardiologists that I have the good fortune to work with. If you come here and you report your symptoms, and you're not going to be ignored, you're not going to be told that it's stress, that it's stomach acid, that it's nothing. You're going to be treated and taken care of.